Hello everyone. So we are going to start the new chapter. The new chapter is the hypercholesterolemia and atherosclerosis. So this presentation, it is divided into two parts. The first part, it's the hypercholesterolemia, and the next part, it is the atherosclerosis. So in this presentation, we are actually going to deal with different clinical condition or pathological condition which generally gets started in the human body as a result of high amount of cholesterol in the human body. So we all know that this cholesterol in a lower amount, they are always useful for the human body, but once the amount of the cholesterol it rises in the human body, it generally brings the body to such a condition which actually it becomes difficult to strive, means the body it suffer from different sort of complication. So without wasting any time, let's start the first part, that is your hypercholesterolemia. So basically, if we see in the background, we know that the cholesterol we have already discussed. So what is the cholesterol? It is basically a lipid or a waxy or a fat-like substances, right? And it is basically produced in the human body, in the liver, and sometimes also in the other cells, right? Apart from that, there are certain foods which generally we used to take with our diet. For example, the dairy products, the eggs, the meats, they contain high amount of the cholesterol. And we know that this cholesterol, it is actually important in different way in our body. First of all, this cholesterol, they are utilized in the human body for making the plasma membrane, or you can say the cell membrane. Apart from that, we have discussed that this cholesterol can be synthesized into the bile acid. They can be synthesized into the different types of steroid hormone, as well as to the vitamin D, right? So basically, actually, the cell walls, right, the membranes, right, the membranes of the cells, they also need the cholesterol. Apart from that, the hormones, vitamin D, bile acid, there are different things which are actually needed in our body, which are generally produced from the cholesterol. But one important thing is that basically you should know that this cholesterol, they form the biles, and this bile itself, they helps in digestion of the fats. So there is a interrelationship between this metabolite of the cholesterol, that you can say the bile acid, as well as the cholesterol, that is the parent compound. Now this is the basic structure of the cholesterol. We all know that, right? Now if we see the types of cholesterol which are present in the human body, so we know that the cholesterol, they generally remain in a different form in the human body. They generally get associated with different fatty acids, and sometimes they get associated with different proteins. They generally form the lipoproteins, right? So there are different types of the cholesterol which are generally present in the body. So starting with the types, so basically with the first type, it's the LDL. That is the low density lipoproteins. Actually, you should keep one thing in your mind, that this low density lipoproteins, they are actually generalized or categorized as a bad cholesterol, because as they have the low density, we all know that if the density of a particular thing it is less, the thing it remains floated. Suppose, for example, if we consider, suppose we have a pure ball of iron and a ball of thermocol, right? We put these two balls together in the water, you can see that the iron, it immediately comes down, or it immediately sink, right? As because it have a high density, right? Whereas the thermocol ball, it will remain at the surface due to its low density, right? So similarly, in the case of the blood also, you can see here that low density lipoprotein, actually they don't sink, means they used to float. And this low density lipoprotein, they has a tendency to build up the plaque. So what is a plaque? Basically, regarding the formation of the plaque, we are going to discuss in the next part, that is the atherosclerosis. But for the time being, I can tell you that the plaque is nothing but it's a formation of a bud. Bud means a structure, means it can block. What it can block? this plaque, they can form a bulb-like structure, or you can say an outgrowth, which will stop, or which generally it forms in the walls of the artery. It generally decrease the amount of the blood flow. Now, the more amount of the LDL there is in your blood, the chances or the probability of getting a heart disease increases. Thus, you can say that the LDL, it is directly proportional. The amount of the LDL in the human body, it is directly proportional to the chances of getting the heart disease. The next one, it is the high density lipoprotein. Now, these high density lipoproteins, they are generally categorized as a good cholesterol because they have a high density, right? They can easily sink. Now, actually, they helps the body to get rid from the LDL, right? Now, maintaining a higher level of the HDL is always good in the human body. So, we should always have a higher amount of the HDL as compared to that of the LDL, right? Apart from this, we have also the very low density lipoprotein, which is also known as the VLDL. It is similar to actually the LDL only, and it contains mostly the fat and not much of the protein, right? One more form is there. Actually, these are known as the triglycerides. So it is the free, actually it's the free fats, right? So triglyceride, it is considered as another type of fat, and it is carried out in the blood. Actually, this triglyceride, it is carried out in the blood by the virtue of the VLDL. So how this is formed, these triglycerides are formed. Actually, this triglyceride, it forms in the human body or in the blood due to the excess amount of the calories or alcohol. If you take high amount of the alcohol or high amount of the sugar is present in the blood, or excess of the calories you used to take, they immediately get converted into triglyceride, and they are generally stored in the fat cell throughout the body. Now, we are going to discuss different factors which control the level of the cholesterol. So what are the different types of the factors? So which are going to control the level of the cholesterol? The factors which are included, first of all, it is the diet. So we all know that, or we used to say that keep control over the diet to control the cholesterol, right? So actually the saturated fat and cholesterol in the food, whatever we used to eat, right, it increases the level of the cholesterol in the human body. So to lower the cholesterol level, you simply avoid the food with saturated fat or high cholesterol, right? That is the first factor which control the diet. The next factor, it is the weight. So it has found that in addition to the being a risk factor for heart disease, right, the cholesterol, but overweight also increases the cholesterol. So once the person is overweight, the amount of the cholesterol in his body, it increases. So in such cases, if we want to decrease the level of the cholesterol, the person should try to decrease the body weight, which will definitely help to reduce the level of the cholesterol. And by losing the body weight, it can also help to reduce the level of the HDL also. Next one, it is the exercise. So it is always said that to exercise, to have a physical work daily, physical activity daily, it helps to prevent the body from different types of diseases. So it is generally considered that the regular exercise, actually it can lower the level of the LDL as well as it can raise the level of the HDL. HDL is a good cholesterol, whereas the LDL is a bad cholesterol, right? So for the sake of convenience, it is considered that the usual physical activity of at least 30 minutes on a daily basis to be done to reduce the amount of the cholesterol in the human body. The next factor, it is the age and gender. Now, how age and gender, it controls the level of cholesterol in the human body. So as we get older, right, you should know that as we get older, the amount of the cholesterol in the body, it increases. Thus you can correlate this concept that as the person grows, the amount or the chances of getting the diseases like lifestyle diseases in our days like hypertension, it increases. I will show you, I will explain you how this hypertension, it is associated with that of the cholesterol. But for the time being, you should know that with the increase of the age, the amount of the cholesterol, it always increases in the body. But in case of women, actually, for the gender, I'm telling you, in case of women, it has been found that before the age of menopause, means before reaching the age of menopause, around 45 years, right, the women tend to have a lower total cholesterol level than the man. You should know that. So means once a woman she reaches the age of 45, the amount of the cholesterol it comes down, and it is very much less and as compared to that of the man. But after the menopause, the woman LDL's level tends to rise abruptly. That thing also has to be considered. Now next factor, it is the diabetes. So a poorly controlled diabetes, if your diabetes it is not controlled properly, a poorly controlled diabetes actually it increases the cholesterol level. So I hope you will, or you can easily make a link, because I have already told you regarding the consequences of uncontrolled diabetes in my previous classes. So once the level of the sugar it increases in the body, what the consequences is, right? Now this poorly controlled diabetes is actually increases the level of the cholesterol. So having the control over our diabetes can indirectly or directly control the level of the cholesterol. The next one, it is the heredity. So the last one, actually, our genes actually they partly determine how much cholesterol our body makes. So it is always observed that if your parents they are lean and thin, the child they also becomes lean and thin. And similarly, if the parents they are healthy and means fat, the child also becomes healthy and fat. So sometimes the obesity, or you can say they are overweight, the parameter, these are somehow related with that of the your parents by some genetic relationships. The next part, it is the hypercholesterolemia. Now what is that actually? So hypercholesterolemia means high amount of the cholesterol in the blood, right? Now it's a major risk factor for heart disease and to get stroke. If you have a high amount of the cholesterol in your body, then you are increasing the chances of getting heart disease as well as stroke, right? Now you should know that the abnormal levels of LDL cholesterol, it is the bad cholesterol, right, or the HDL cholesterols are treated with a low fat diet. So whenever you are obese, whenever a person is obese, that person may show abnormal level of LDL or HDL, right? In such cases, the person he is treated with low fat diet. The physician they used to tell them to have physical exercise, and also they used to be given some drugs, and these drugs are known as the statins. I hope you remember what are statins. The statins are those drugs which are actually the blockers of a specific type of enzyme which is known as HMG-CoA reductase inhibitor. We have discussed about this thing in the synthesis of the fatty acid, right? Now, what are the diseases which are linked to hypercholesterolemia? So there are different types of diseases which are linked with the hypercholesterolemia. So basically, this high cholesterol level in the blood actually it increases the chances of cardiovascular disease first. Moreover, you can see that now that can include, this cardiovascular disease can include heart disease. You may suffer from stroke. Sometimes you may also get peripheral vascular diseases. Moreover, this high cholesterol they have been also linked to diabetes as well as high blood pressure. Now coronary heart disease. So let's discuss how it happens actually. First of all, you should know that this cholesterol level they are, suppose we are considering a clinical case, so this cholesterol levels they are rising in the body, right? First of all, right? Now this cholesterol level, what they are going to do, they are having a tendency to develop coronary heart disease, right? Now how they are going to develop? Suppose, for example, let's consider there is a tap and you have a pipe, right? Now once you open the tap, the water it flows through the pipe, and if no blockage is there in the pipe, the water, it reaches at the same force, maybe the amount, maybe force may be quite little based on the length of the pipe, but it comes out with the same amount. Now suppose if the same pipe, in the same pipe itself you put some blockage, means you have put some mud inside it, or you have stick something which actually hinder the flow of the water through this pipe, what will happen? The amount of the water coming out from the tap, right, or from the pipe, it will decrease. The tap you are opening, right, you are opening the tap completely, but the amount of the water is coming to a less amount, right? It is due to the presence of that particular plaque, right? Or you can say you have put some dust or mud somewhere in this pipe, right? So let's consider the tap as the heart and this pipe as the artery and this mud as the cholesterol, right? Now this cholesterol, first of all, you should know that it has a tendency to build up in the arteries, right? Now over the time, means slowly and slowly, when the plaque starts developing, this over the time, this build up or the plaque, it starts, actually it causes the hardening of the arteries. The arteries will become hard over the time, right? And this condition, it is also known as atherosclerosis, right? Now once it will become hard, the arteries now they are going to become narrowed, right, which slows the blood flow to the heart. So if we consider again the tap and the pipe here, if we consider now the tap as a peripheral organ and the other end of the pipe as the heart, you can now consider the condition. From the peripheral organ, you have opened the pipe fully. In the pipe you have the plaques, right, and the outer part or the end of the pipe which is free, that is the heart. Now the amount of the blood, or now here in this case the amount of the water, it comes down, right? So what will happen? The blood flow to the heart muscle will come down in this case, right? Now this reduced amount of the blood flow, it can actually it can cause different complexities. First of all, it can cause angina. Angina is nothing but it is referred as a chest pain, right? So in a heart attack, or sometimes it can cause heart attack if the vessel or if the arteries it get completely blocked. If the pipe it is completely blocked, then it can give you attack. The next relation, it is the cholesterol and stroke, how they are related. So basically you see, the atherosclerosis causes the artery that led to the brain to become narrow and even blocked. I repeat, the atherosclerosis, they causes the artery. So for the brain to work, you have the artery supplied to the brain also, right? Now these arteries, they are carrying the basically the oxygen as well as the glucose to the brain, right? Now if the atherosclerosis it progresses in your body for a long time, it can block these cranial arteries, means these arteries which are carrying blood to the brain, right? And they can become narrow, sometimes they can become blocked. Now if a vessel carrying blood to the brain is blocked completely, we could have stroke. So at that time the person may suffer from stroke. Next relation, it is the cholesterol and the peripheral vascular disease. So apart from that, we are considering till now the blockage of the coronary arteries, means the arteries which are supplying the blood to the wall of the heart, or the cranial arteries which are supplying to means blood to the brain. But what about the peripheral arteries, means the arteries which are taking the blood to the peripheral tissue, or the means blood supply from the peripheral tissue to the heart? Actually in this case also, what actually happens, this high cholesterol also has been linked with the peripheral vascular disease. This referred to the disease of the blood vessel outside the heart and brain. In this case, different types of complexity arises. So in these conditions, what actually happens, the fat deposit build up along the artery walls. Whatever the artery are there for supply of the blood to the peripheral tissue, they will now have the plaque, right? And this may lead to what? this may lead to the weakening, or you can say the less blood supply to the peripheral areas like your legs, like your feet, etc. The next part, it is the cholesterol and diabetes. So how they are related? So basically you see, the diabetes can upset the balance between the HDL and LDL cholesterol levels, first of all, because the HDL, it is a good cholesterol, whereas the LDL, it's a bad cholesterol, right? So diabetes has a tendency to imbalance this, the ratio between the HDL and the LDL, and people with the diabetes, they tend to have LDL particles. I repeat, people with diabetes, they tend to have LDL particles that stick to the arteries and damages the blood vessel walls more easily. So in case of diabetic patient, the amount of the LDL particles is more, and which results, or which can result in the damage of the blood vessels more easily. Now how it happens actually? You see, basically we know that in an uncontrolled diabetes or in a diabetic patient, the glucose, right, the amount of the glucose, it is always high. Now what actually happens there? This glucose, it attaches itself to this lipoprotein. Suppose LDL, it will attach itself. Now once this glucose will attach to the lipoprotein, what will be the consequences? See, this sugar coated LDL, earlier we have the LDL in case of diabetes, due to the high amount of the sugar is there, as there in the blood, this sugar is going to coat this LDL, right? This sugar coated lipoproteins, they remains in the bloodstream for a longer time. They will remain in the bloodstream for a longer time, and this can easily actually, they form the plaque. Moreover, the people with diabetes, they tend to have low HDL and a high triglyceride level. So both these actually, they boost the risk of heart disease as well as artery disease. So diabetic patients, they are more prone to the heart disease as well as to the artery disease. Now the relationship of the cholesterol with that of the blood pressure. So what is the relationship? So first of all, we know that the high blood pressure, it is also known as a hypertension, right? And the high cholesterol, they are linked. How they are linked? As I already told you in my previous slides, that after attaining a certain age, because we know that with the increasing age, the amount of the cholesterol deposit in the body, it increases, right? Now in today's world, we can find that with an increasing age, right, with the increasing age, the lifestyle diseases in our today's world, which are the considered as a hypertension or hyperglycemia, they also increases. Now how they are connected actually, you see here. First of all, when the arteries, it becomes hardened due to the deposition of the plaque, right, narrowed with cholesterol plaque and calcium, the heart has to strain much harder to pump the blood through them. I repeat, when the arteries become hardened, when it is going to become hard, when the cholesterol, they are going to get deposited, right? When the cholesterol, they are going to get deposited, they are going to become hard as well as narrow. Just remember the consequences of the tap and the pipe, right? Now in such cases, the heart, it needs to pump, or it needs to work more, because there is a blockage in the pathway, so it needs to work more to pump the blood through this pipe or the artery. In case of body, it's the artery. In case of tap and pipe, it's the pipe, right? Now as a result of which, the blood pressure becomes abnormally high. This is the reason. Means when the heart needs to pump out the blood throughout the body, earlier if there is no plaque, then the heart pump at the normal rate, right? There are two types of pressure. I hope you know that, the systolic and the diastolic pressure. So the systolic, it is the limit, the normal range, it is the 120, the diastolic is 80 mmHg, right? Now when there is a blockage, now the heart, it needs to pump at a high level so that the blood can be completely transferred to all part of the body, and because of which the pressure, it becomes abnormally high. And this is the way this high blood pressure, it is also linked with the heart disease. Now whenever you get any patient who are in a high amount of cholesterol, then that physician, they used to advise that patient to have a lipoprotein profile. Now, what is basically a lipoprotein profile? So if we check a patient in a clinical condition, we used to have a lipoprotein profile. The lipoprotein profile is nothing but it's a profile to evaluate the following. What we are going to evaluate? First of all, the amount of the HDL, that is the good cholesterol. Next, the amount of the LDL in the blood, that is the bad cholesterol. The total cholesterol level as well as the triglyceride. So these are considered whenever we are going to check the lipoprotein profile of a patient. Now you see here the LDL. So the LDL, it is always referred as a bad cholesterol, right? We all know that this LDL cholesterol, they can build up in the walls of your artery, right? And it increases your chances of getting the heart disease. So that is why LDL cholesterol, lower the LDL number, lower is our risk. So you should remember this thing. The lower is the amount of the LDL. So if we check the amount of the LDL, lower is the amount of the LDL, lower is the chances of getting a heart disease. Similarly, HDL. So HDL, it is referred as a good cholesterol. This is because this HDL actually protects against heart disease by taking the bad cholesterol of our blood and keeping it from building up in our arteries. Actually, we have already discussed about this thing, how HDL, it actually reverts the process of cholesterol synthesis. This HDL, they have a tendency to slug off the unnecessary or bad cholesterol, that is the LDL, from the human body. So thus a statin can increase our HDL. If we use a statin drug, it can increase our HDL, as can exercise. So exercise is the best medicine to increase the HDL in the human body. The next one, it is the triglyceride. So triglyceride, they are in the form in which most of the fat exists in the food and the body, right? The triglycerides. So we know that how these triglycerides are from. The triglycerides are generally from the high calorie diet, alcohol, etc., right? Now, what is the total cholesterol? Our total blood cholesterol is a measure of LDL cholesterol, right? HDL cholesterol and other lipid component. It's the total cholesterol, right? So this is the overview of the hypercholesterolemia, or you can say cholesterol. So if you like the video, just press the like icon. You can share this video with your colleagues, and for further notification from this channel, you can press the bell icon. So thank you everyone.